Let's try to define rural health before diving deeper into the topic. The audience of the podcast is global, and I find it quite interesting that when we're talking about rural health, it can mean very different things in different countries. So, for example, in smaller countries, rural can mean 20 minutes away from the city with a hospital, whereas in the US, distances are much larger. So I just want to know, what was the most remote area that you visited during your research and field interviews? How many hours are we talking away from civilization?
Yeah, it's a really great question. So the formal definition of rural markets is less than 2,500 people in a community. And yet there's a combination, as you mentioned, around density of population and distance to travel. And so one of the things that we noticed in our research is that many people live in what are called health deserts, where they're typically expected to travel anywhere between 2 to 5 hours to access healthcare. 2 to 5 hours. So think about going to your primary care doctor for a 15-minute visit and having to travel 5 hours to get there for a 5-minute visit. And if you're an hourly wage worker, it's unlikely that you're going to take a full day's off, lose a full day's worth of wages to receive a very short amount of time in terms of clinical care. And so in many ways, this idea around health deserts and health access is what prompted us to think differently about rural health markets. So when we approached the problem, we asked ourselves, if you were going to design healthcare service delivery in rural markets, would it look like it does today? And the answer is no. You wouldn't build a center and ask people to go to the center over large distances with the lack of infrastructure, lack of public transportation. In fact, you'd probably turn the delivery model on its head and think about how can we bring healthcare to people rather than putting the burden on individuals to go seek healthcare in a world that doesn't provide it or make it very easy.